My name's Mary and I'm an Associate Nurse Unit Manager in the Medical Day Stay Unit on Bellarine Centre 6 North. I relocated here over 15 years ago from Westmeath in Ireland. Went to Edinburgh first and then landed in Melbourne. Worked at the Alfred for a few years, and then when it came to settling down and buying a house and having a family, we moved down to Geelong. Decided to work at Barwon Health because it's the biggest healthcare provider down here, the biggest public hospital. So that was what attracted me here. So I've been lucky enough to have a very varied career at Barwon Health. I started as a nurse on the wards, as a registered nurse. Worked all over the hospital in all the different wards that were there. Then I became an educator, worked with the student nurses through Deakin University. And then following the birth of my first daughter, I took a job in the day unit and I'm the Associate Nurse Unit Manager there. I've been fortunate enough to be part of the COVID vaccine programme. I took a secondment to do that with the newly formed Public Health Unit at Barwon Health. And as part of that, I've now started to study a postgraduate certificate in public health, and that's been supported through my Nurse Unit Manager with study leave and academic leave and time off to facilitate that study. So Barwon Health work very closely with Deakin University. They have lots of different nursing programmes that are run through Deakin and other universities, which offers us the ability to specialise in different streams, whether that's ICU, dialysis, aged care, mental health, and that's all supported through paid study leave and supervision on the wards and in different clinical areas. I love the community feel of Barwon Health. I think everybody knows somebody who's has worked at Barwon Health. Everybody's either been born here or they've been a patient here over their lifetime. People who work at Barwon Health are very proud to support their community, and the community are very proud to support them in return. And it's not very often you get that in a health organisation. So we're lucky in Australia, well in Victoria, that we have legislated ratios. So on the wards, the maximum number of patients that you will look after is 4 patients to 1 nurse, which is very different to back home and in the UK. The pay is quite good. The lifestyle is probably the best thing about working here. Geelong is just such a beautiful centre for it's got an emerging art scene, great food scene, lots of arts and culture down here, amazing beaches, beautiful food, wine, and it's got a good mix of coastal and rural lifestyles, which is kind of very attractive to live down here and not be stuck in the rat race of Melbourne. So I'm fortunate enough to live in Ocean Grove, which is about 20 minutes outside of Geelong on the Bellarine Peninsula. Magnificent little town with amazing surf beaches, beautiful food scenes, great schools down there. It's just a gateway to the coast. Plus you're only 20 minutes from the city, an hour from Melbourne, so you really get the best of both worlds.